everyone. We're delighted to have you all with us. And today's speaker is Kate Nolan. She's a nurse practitioner in the gynecological oncology department at Beth Israel Deaconess Medical Center here in Boston. She was my nurse practitioner when I was going through cancer treatment. And she's also the director of the Kind Clinic.
Hi, everyone. Thank you so much for listening. This is very exciting. And I love that Melissa and Kathy have started this wonderful program just to provide so many different women, well, not women, nurse practitioners, healthcare providers that can provide just kind of all of our different expertise in women's health, which there are so many different, layers to women's health. This is amazing what you do. So, so my name is Kate Nolan, and I started the Kind Clinic, which stands for Kate's Intellectual Disability Clinic. It is a GYN clinic that provides GYN services for women with intellectual and developmental disabilities. And it's 21 years and up. So I follow the same ACOG guidelines that we follow for typical women. So we start pelvic exams and a PAP at 21, and then we do HPV testing after age 30. And a lot of the complaints are, I don't want my daughter to have her period, or if they're in a group home, or if they're living in an institution, they don't want to have their period, number one, because, say if they're autistic, they have problems with just having blood or seeing blood or wearing a pad or any of that, or if some parents just don't want to have to deal with the mood changes that happen. So they want this menstrual manipulation to happen, which is something that is very healthy. The other reason is that they want to stop periods is a lot of my patients have seizure disorders, and a lot of the seizure medications are contraindicated with hormones. And then also seizure activity can get worse with the fluctuation in hormones during our cycle. So that's another reason why, doing menstrual manipulation is very important. The other reason is that they want to stop periods is a lot of my patients have seizure disorders, and a lot of the seizure medications are contraindicated with hormones. And then also seizure activity can get worse with the fluctuation in hormones during our cycle. So that's another reason why, doing menstrual manipulation is very important. Each appointment, I give an hour to my patients. We talk about what to expect in an exam, what's going to happen. No one likes to get a pelvic exam, right? But it's something that you just do it because you're a woman and you got lady parts. So we have to manage that. So I just talk them through, show them what I'm going to do. And sometimes I'm able to do the exam that day, and sometimes they have to come back.
So a question for you about, because I think this is helpful for a lot of our listeners to hear. So it sounds like you did a lot of advocating for this clinic and kind of like persevered with, you had this goal and, you just had to continue chatting with people. What's some advice that you would give to people who want to maybe create a clinic within their department? How would you go about doing that?
I think if you have a goal and you really have a passion about it, you have to have that passion about it, then you continue just to talk about it, and you talk to the right people. So management, you can go to the higher ups in your facility and just say, this is what I think needs to be done, and this is a good idea, and this is what's right for our patient population.
So that kind of leads us to our conversation about intimacy while dealing with a cancer diagnosis.
Most patients say to me, wow, I've been seeing Dr. So-and-so for the past 4 years, and he or she has never asked me if I was sexually active. And I think that that's wrong, because I think it's part of a surveillance for a cancer diagnosis that we want to make sure that we can get you back to some sort of normalcy in your life after you've gone through surgery, treatment, and now you're in the survivorship. I think just setting up the expectation that things aren't going to be the same, but you can be creative and try different things with your partner in different positions. And, having vaginal intercourse isn't the only way that you can be intimate too. So,
amen.
Exactly.
Yeah, that's great. And you made such a big difference in our lovely Kathy's life.
Oh, Yeah.
survivorship.
Totally,
So, I
Kate.
mean,
I will be forever grateful to you. You're
But
the whole reason I do what I do, really.
that's what, yeah, I know, which is absolutely amazing. But Kathy, like when I asked you to do pelvic floor physical therapy, like what was your initial like kind of
good
like
question.
thought? Like,
Great
if it's, I
question.
mean, if it's too
No,
personal, like
not at all. Not at all. I had no idea what you were talking about. And I ran a women's health program for 4 years. I was 4 years in.
yeah,
Colposcopies, IUDs, endobiopsies, all of it. So many
yeah.
pelvic exams. And I was like,
Well,
All
it was
right. Well, this
so
was
lovely
wonderful. You
chatting
guys
with
are
you.
amazing.
you
And
are
have
a
a great
gift.
day.
You are,
Yes,
yeah.
you are
Absolute
too.
gift.
You are
Thank
a
you
gift.
so, so much.
Thanks so
Yes, this
much,
was
Kate.
awesome.